Depression is a medical condition that causes profound, long-lasting sadness. Transcranial magnetic stimulation is an FDA-approved treatment that increases neurotransmitters in the brain without the use of any pharmaceutical drugs. Dr. Ashwini Saxena is the Chief Medical Officer at the Mental Health Center of Greater Manchester. He spoke to us about how he uses TMS to treat depression in his patients.
In the United States, nearly 20% of the population experiences depression at some point in their lifetime. The first-line treatment of depression involves psychotherapy and medications, or the combination of two. However, about 1/3 of the patients do not experience improvement in their symptoms. People with untreated depression have a lower quality of life, a higher risk of suicide, and are almost twice as likely to die compared to people without depression. TMS is a non-drug treatment where a coil generates magnetic field, similar in strength to an MRI. It is applied in the left prefrontal cortex of the brain. The pulsed magnetic waves stimulate the brain in a specific area that is responsible for mood regulation.
TMS is non-invasive, it does not require anesthesia, and it is generally well tolerated. The most common side effect of TMS is scalp discomfort, which generally becomes more tolerable after the first several treatments. Each treatment takes about 19 minutes and is administered 5 days a week for 7 weeks. Some patients can benefit from maintenance treatments after their initial course of TMS.
Some patients experience improvement within a few days of starting treatment. Some patients may experience improvement around the end of the treatment. Research suggests that many patients remain in remission for at least a year. In this patient population, about 50% patients experience improvement in their symptoms, and more than a third experience complete resolution of symptoms. The mission of the Mental Health Center of Greater Manchester for more than 50 years has been to provide evidence-based treatments to people suffering from mental health disorders. With TMS, we take a giant leap in providing most advanced treatment of depression locally in our Greater Manchester community.
The Mental Health Center of Greater Manchester has been serving children, teens, adults, and seniors since the 1960s and will help and treat each person regardless of age or diagnosis.